Hi there. Hello, Miss Melnikova.
Hello.
There are situations where the blood sugar drops below 3.9, and yet there are no symptoms of hypoglycemia. Could you elaborate on that, please?
This is a common question among our patients, people with diabetes. This condition is true hypoglycemia because the absence of symptoms is not as significant as glucometer readings. Truth be told, many patients do experience certain changes in how they feel at the moment. However, those changes are not as pronounced as they once were and are, therefore perceived as insignificant. Another aspect of this phenomenon that I believe is relevant here is long periods of effective diabetes management with blood sugar levels very close to the norm. Such patients do not perceive the blood glucose level of 3.9 as a drastic change and therefore experience no malaise. Now let's ask ourselves a question. Is it possible that people without diabetes have a glucose level below 3.9? During long-term fasting, or in their sleep, or after intense physical activity? Is it possible in theory?
I don't think so. I've heard of people going for weeks without food and surviving.
Of course, we never said that the blood sugar level 3.9 is life-threatening.
To be honest with you, I don't know what their blood sugar level is.
Let me tell you a little secret. If someone were to check blood glucose level in people without diabetes, they would quite frequently come across numbers lower than the accepted norm. The definition of the norm is intentionally narrower than the actual safe range in which the fluctuations of blood glucose level cause no consequences. The thing is, in people with no diabetes, there are no factors that can lower an initially low glucose level to an unacceptable one. In people with diabetes, on the other hand, if the blood glucose level drops due to the excess of insulin, the insulin effect cannot be reversed and certain measures must be taken. To recap, it would be a gross mistake to say that one should do nothing at the glucose level 3.9. However, there is a range of possible scenarios. Let's say a patient with diabetes spends a whole day with glucose levels of 4.5, 5.2, 3.9. It's mealtime. The patient feels great because their blood sugar level has been within the norm for a while. Should they do anything else in addition to having the meal? Most likely not, because there is no drastic change. Another example, a patient has the same level 3.9 and feels great, but this level is registered after physical activity. The patient is tired and cannot clearly identify the presence of hypoglycemic symptoms because he or she is now experiencing sensations very similar to hypoglycemic symptoms: palpitation, sweating, weakness, and hunger. Let's say the next meal is not until after some time and he or she cannot eat right away. Should they do anything with this level to prevent a further
I
drop?
think they should, yes. Hypoglycemia is dangerous.
Hypoglycemia is not more dangerous than hyperglycemia. It's dangerous to misinterpret certain events. If a patient is aware of the low level, anticipates a further drop, but takes no preventive measures, that's a mistake. In this particular case, some extra carbs, of course, would be a reasonable solution. Another scenario. The blood glucose level is 3.9. The last insulin shot was administered just an hour and a half ago. The drop is significant compared to the level registered before a meal. Even if a person experiences no malaise, no change whatsoever in how they feel, still this level should be considered true hypoglycemia. The person should not simply consume extra carbs, but rather use a sufficient amount of fast-digesting carbs. If the patient is negligent and ignores the low level of blood glucose, it will be a mistake that will most definitely result in the occurrence of hypoglycemia. Another category of patients who, unfortunately, may truly have no complaints after the blood glucose dropped to 3.9 are people with a long history of diabetes and pronounced complications. Their ability to recognize hypoglycemic symptoms decreases. Unfortunately, this ability cannot be completely regained. Doctors set slightly higher target levels for such patients and risk their compensation because the risk of hypoglycemia, including severe cases, is higher in these people.
Thank you, Ms. Melnikova. Today, I learned about asymptomatic hypoglycemia. Even if it has no symptoms, it cannot be ignored.